Crossfire here on Nigeria Info 99.3. I am Sheriff Quadry. It's my pleasure to be here and nice to meet you as well. Very, very nice to meet you. Guess what? We're about to have a conversation about malaria. And we want to know what exactly Lagos State government is doing about malaria treatment, affordability, access to care when it comes to malaria, and the plan of the state government regarding this disease. You know that we're a tropical nation. Lagos, particularly, is just right there at the center of everything. And that's why this conversation is pretty much very, very, very important. Thank you for joining us again this Thursday morning on Nigeria. This morning, though, as we examine one of the most stubborn public health battles in Nigeria, malaria, we must also acknowledge that yesterday, September 10th, the world marked World Suicide Prevention Day. As a reminder that mental health deserves as much attention as physical health. So we will touch on this briefly so that we know how important that yesterday's commemoration was or is. The 10th of September each year aims to focus attention on the issue of suicide, to reduce stigma and raise awareness among organizations, government, and the public. And according to WHO, suicide is a major public health challenge with more than 700,000 deaths each year globally. According to the World Health Organization, more than 720,000 people die due to suicide every year. Suicide is the third leading cause of death among 15 to 29-year-olds, and 73% of global suicides occur in low and middle-income countries, according to Punch publication yesterday. And look, Nigeria is not exempt from this particular stat, okay? WHO says there are at least 20 unsuccessful attempts for every completed suicide, which means it could have been more. The figure could have been more. Yesterday, the theme for the 2024 through 2026 is changing the narrative on suicide. And this underscores so many things. In Nigeria, one of the most significant barriers to help or seeking help has been the criminalization of attempted suicide under section 327 and 231 of the criminal and penal codes, as the punitive approach has discouraged distressed individuals from seeking help and worsened stigmatization. So to address this, the federal government inaugurated a national task force on the decriminalization of attempted suicide on October 10, 2024 last year. This particular task force is chaired by Professor Cheluchi Oyemelukwe, with a mandate to guide Nigerians' transition from punishment to a public health-oriented, compassionate response to this issue of suicide. So, in fact, I and my team, we have decided to bring this particular conversation back next week. Let's have a conversation on suicide prevention, mental health in generally. So on next week, Thursday, next week, we're going to have this conversation. Now, back to our conversation today. Nigeria is responsible for a staggering 31% of global malaria deaths and 27% of total cases worldwide. If you're not bothered by this, I don't know. Now, despite decades of interventions from local government to international organizations, despite all of this, malaria continues to claim lives, especially among young children and pregnant women. And this malaria, it drains households financially. Now that medication is very steep, it slows productivity. It keeps our healthcare system under constant pressure. Now, how close are we to eliminating malaria in Lagos State? Because this is where we are. And what must change for us to break free from the grip of malaria? Now, to help us understand where we stand and what's needed, I'm joined by Dr. Abimbola Osinowo, manager of the Lagos State Malaria Elimination Program at the Lagos State Ministry of Health. Dr. Osinowo, good morning to you, madam. Thank you for joining us.
Good morning, and thank you so much for having me.
It's good to have you. Now I'm going to drop some numbers before we get into it. Now, according to the World Malaria Reports 2024, Nigeria accounts for approximately 27% of global malaria cases. Over 97% of Nigeria's population is at risk of malaria, and Lagos is no exception. The state's large population and humid environment create ideal conditions for malaria, especially malaria carrying mosquitoes, to thrive. Children under 5 and pregnant women are the most affected by malaria. These vulnerable groups account for the highest number of malaria-related deaths in Nigeria. Dr. Shinawa, let's start this way. Lagos State reports malaria prevalence has dropped to 1.3% in 2025. How significant is this one? And what does it mean in practical terms when we say that Lagos State reports Lagos State malaria prevalence has dropped to 1.3%? What is the meaning of it? Can you break it down for our audience?
Yes, I will. Okay, thank you so much, and good morning, everyone. Let me just give you, like you have mentioned, like you've explained, there's a global population of about 243 million individuals affected by malaria. Of this, Nigeria accounts for 27% of the malaria cases and 31% for malaria deaths. Now let's cone it down to Lagos. In Lagos, from the National Malaria Indicator Survey of 2021, our prevalence is 2.6%. Let's assume it's approximately 3. So what it means is that if 100 people were to be in if you are to assess 100 people, about 3%, 3 of them probably would have malaria. So as it is, Lagos has very low malaria prevalence. But then that 3%, if we look at it in terms of our population, if we multiply that 3%, the total population of Lagos, we are assuming is 30 million. Then it's a lot. In fact, that math is about 3 million individuals being affected by malaria. About 1 million, of individuals being affected by malaria. So it's still very high, despite the fact that our prevalence is low. Because if you look at the population base, we still have a lot to do.
Talking about being high, Dr. Shinawo, which groups would you say are most affected by this?
We've actually highlighted this. Our pregnant women and children under 5. The reason is very obvious. With our children, the immune system, and with our pregnant women, you know that when a woman is pregnant, there are loads of things that happen. Her blood, she's carrying an extra human being. So definitely her immune system is also compromised. So those are the 2 individuals that are really focused on. And besides that, if you want to assess how a country is, you would look at the infant and maternal mortalities. If they are high, then the country isn't doing well. If they are low, then the country is doing well. So that is why we're actually looking at them. They are referred to as a vulnerable group. We really concentrate on these individuals. Not that we are not interested in the others. Yeah. The others are equally important because the elderly too can't come down with malaria. And people with compromising status, like sickle cell anemia and any form of disease that the immune system is reduced, definitely they can also be prone to getting malaria. But our concentration really, I won't say our concentration, but we put a lot of emphasis on children under 5 and pregnant women.
But how much burden is this for Lagos State government? How much is it? How heavy is this burden? Can this be handled?
It can be handled. In fact, the Honorable Commissioner and the state governor, Mr. Babajide Sanwo-Olu, and the Honorable Commissioner, they are really gearing towards ensuring that we reduce malaria to the barest minimum in Lagos. And malaria, many people focus on the health aspect, but malaria is all encompassing. It's not just about Ministry of Health. It's not just about popping up, getting diagnosed and getting treatment. It starts long before then. Our prevention. Now, let me take you back.
Okay.
When we consider our environment in terms of the way it is, the status, how good is our environment? Are we actually breeding mosquitoes in our homes? You may not realize it, but you probably are. So you have containers that you have water in them. You need to ensure that those areas, they're actually breeding, we refer to them as breeding sites. So anything that can hold water, you don't have water at home, you have an open container, you have pots and pans scattered all over the compound or premises, they are breeding sites. Gutters in front of our homes They are breeding sites. The potholes too can serve as breeding sites. So anywhere, or even abandoned buildings that have portions of water puddles here and there, they are breeding sites. Uncovered wells are breeding sites. So there are so many things you have to consider in that regard. You also have to understand that it's not just, like I said, it's not just a Ministry of Health issue. Every other person, every other aspect comes in place, and everybody has a part to play. We want to ensure that it's not just about the government. You as an individual, what are you doing? Are you sleeping inside the net? Because the net do prevent malaria. What are you doing? Are you ensuring that if you are pregnant, you are taking the intermittent preventive therapy, which is sulfadoxine pyrimethamine, at the recommended times? Because you're expected to start your second trimester and take it monthly till deliver. So you can have up to 5 doses before you have the child. And then when you get malaria, are you actually being diagnosed properly? Or you're just assuming because you have a fever, it is assumed that it's malaria? There's so many other causes of fever, malaria being one of them. So there's so many things we also as individuals, we have a part to play, we need to do.
Okay, you have answered, with this response, you have answered about 5 questions that I have on my table. So if you say, yeah, we will just be cracking jokes all morning this morning because you have cleared everything from my script here. But aside that, I'd like to also know, because Lagos, if you look at the geographical location of Lagos, it's like we are designed to be fighting malaria. We are strategically located to say, okay, you know what? The gift of nature to Lagos State is malaria. You people should be fighting it. Are we ever going to be able to handle this for eradicate malaria completely? Is that something that is achievable, or we will continue to manage it as we've been?
I will take you back as far back as that's why we have research to assist us and keep our eyes open. Let us understand what is going on. Let me take you a bit back to what it is that we have done in Lagos. As far back as 2010, 2011, we had a Lagos State Malaria Indicator Survey. And in that survey, the prevalence we talked about now, at that time was 4.8%. Then in 2015, it was less than 1%. And then in 2018, the National Demographic and Health Survey, it rose to 1.8%. And 2021, it's 2.6%. So there was a decline, and then there's a bit of an increase. Now, when you look at that history that I've just talked about, you also have to consider the fact that as much as it looks like we are supposed to be malaria endemic, a lot of things are happening in Lagos. I talked about that malaria is not just a Ministry of Health problem. Urbanization has a part to play.
Oh, okay.
Breeding, we have a lot of breeding sites. Or should I say we used to have a lot of breeding sites. If you look around you, there are lots of new developments that are happening.
True.
Houses,
True.
Roads and all. All of those areas that we have as new developments. Let me even talk about the urban portion. Let's think about Maryland. The Maryland, underneath the bridge in Maryland, that's the construction that is going on now. That area used to be a swamp, and now we have a road. You have removed a breeding site in that portion. If you go to the island, if you go to Lekki, Lekki we are getting Lekki, people are extending Lekki towards Ibeji Lekki itself. You're looking at Etiosa, Ibeji Lekki and even Ekwe. Those areas, you have a lot of construction, you have a lot of homes, you have a lot of houses, you have a lot of roads going on. Urbanization is ensuring that people have live in houses, the transportation is, commuting is okay and all of that. Those things add up. All those breeding sites are going. And because of all of the urbanization that is going on, we are reducing the mosquito population, and automatically the prevalence will reduce. So it's not like I would say again, it's not just a health problem, but it's an economic problem. Because if I ensure that everywhere around me, that we don't have any form of swamp, everything is actually taken care of. We want to ensure that we have water coming out from our homes. NEPA has a part to play. The next that we're talking about, a lot of people have complained that it's we don't use it because it is hot. If they have lights, they would be forced. They would be glad to use it, because obviously at one point or the other, when the room is breezy, you have a lot of air going. It's not hot.
Right.
Then the net will come down.
Right.
So NEPA has a part to play. Water resources, because I mentioned that if you don't have water at home, you are bound to have containers here and there. But if I turn on my tap and the water comes out, then definitely you would know that I won't have any business having water receptacles all over the homes, then mosquitoes are reduced. So in malaria, when you look at malaria, it's not, I will say it again, it's not a health problem alone, but it's everybody's problem. Everybody has a part to play, no matter how little. Even our children. Once you tell a child something, the child will run with it.
All right.
Education in children. We want to ensure that children get the information as early as possible. And then they more or less kind of enforce you to do the needful. And whether you like it or not, you will probably most times abide by their rules because they'll keep singing it into your ears. So those are the things that we are looking at. We are looking at our women, for instance. Once a woman is okay in our house, the rest of the family is taken care of automatically. If our women are empowered such that they don't fall ill and they don't die, the rest assured that home is taken care of. So it's all encompassing. Everybody has a part to play. And then if you also consider the fact that if you get rid of the mosquitoes, or if the mosquitoes are gotten rid of, other diseases also automatically would reduce. Why am I saying this? If you think of our dump sites, because they are also breeding sites, if you're able to get rid of that, rats would reduce. Lassa fever, if it's permanent in that area, would automatically go down. Cockroaches, house flies. So everything is interwoven, everything is related, everything is connected. It's not just a health problem. Everyone has a part to play.
All right. Osinowo, thank you so much. You're a very interesting person to interview. I think this is the first time I'll be speaking with you. You keep clearing my script, but it's okay. We'll get somewhere with this interview at the end of the day. I'm still going to talk to you about vaccination. I'll talk to you about access to care. I'll talk to you about symptoms and all of that. But let me track back a little bit to go and talk about children and pregnant women, the most vulnerable groups that we spoke about earlier. I want to talk to you about whether there is an ongoing program by the Lagos State government to make access to care easy for them and maybe free. Talk to us about this, Dr. Osinowo.
Oh, yes. Pregnant women are, like I mentioned, they're the vulnerable groups. And once you're taking care of that, and morbidities, in that age group is taken care of, then definitely your country or your state, your location is...
Can they access care free of charge? Can they access care free of charge?
For malaria, yes. What are we looking at? For our pregnant women, once they come to register at the time of pregnancy, they get free nets.
Okay.
For the children, once they get the measles vaccination at 9 months, they get free nets. And what it means is that once I know that I'm going to get something free, a lot of times you tend to abide by it. You come over to get, and there are public facilities, these are given out free. For the diagnosis and treatment, once you come in I'm jumping. Let me talk about let me continue with the pregnant women.
Okay.
From the second trimester, they're expected to take what we call intermittent preventive therapy in pregnancy, meaning that they are supposed to take medications to prevent malaria in pregnancy, because malaria can be deadly if a woman is pregnant. So from the second trimester, they take the first dose, and then they continue that monthly until delivery. So they can have up to 4 doses before they have a baby if they register early, and that is free. Now let me get to diagnosis. If anyone, not just any pregnant woman, but anyone gets to our facilities, malaria management, they're expected to be tested for free using the malaria rapid diagnostic test kits, and treatment is also free. So definitely, we're not just focused, as much as it's important for our vulnerable groups, we're also looking at the population at large in terms of malaria management. So it's free.
All right. It's 8:23. We would take 1 or 2 calls. Let's get some feedback in for this first half before we go on a break. When we return from the break, we'll talk about symptoms. We'll talk about vaccination and some other related conversations around malaria and treatments, access to care in Lagos, right? Okay. 0201-277-0993. Dr. Osinowo joins us this morning. We have less than a minute, so if you're calling in, you have to be very, very straight to the point when you're dropping your questions. Good morning to you.
Hello, good morning once again, Ogachari.
Good morning to you.
Yeah, good morning to your guest. This is the merchant man. Ogachari, I want you to ask the...
You can go ahead and ask the question. Just ask her quickly.
Allegation of GMO mosquitoes that's been released by Bill Gates, either to fight malaria. But we know the hidden agenda in most of this man's GMO products. So my question is, in most cases, you see people treating malaria.
Land on your question.
They are growing.
Just land already. We don't have the time.
Yeah, so we have cases where.
Okay, you know what? I have to go on a break. Honorable Commissioner, please. Sorry, Dr. Osinowo. I'll be right back.
Nigeria Info. We'll be right back.
When it's time to cook, don't you stress. Life's kitchen brings the best. Oil, mayonnaise, seasoning cubes. Cause that chocolate coffee so much to choose. Food is ready, not easy. Taste the magic, crystal clear. Delicious, healthy, always true. Lazarus brings your joy to you. Lazarus Kitchen, magic in every taste.
Okay now, dependable insurance. After God, you are the next insurer. See as the boys the Allah, all the ladies the Allah. Ensure your car protection from accidents. Unforeseen loss, you can see them. Mistakes are meant to happen. If you don't jam the car, they jam yours. Will you beat them? Ah yes, you will get them arrested. Your plans for that day is affected. You waste your money, you waste energy. With AXA, you can be protected.
Get the protection that pays today. Call 0700 AXA Mansa to get a motor insurance that pays. AXA, know you can.
Malta Guinness is now 600 naira. Now you get the same refreshing, nourishing, rich premium Malta Guinness for just 600 naira. Available at stores near you. Malta Guinness, here for every kind of you.
Hey, yeah, now Rabi, with Rabi, but it's strong, my mouth is fresh. It clean well, oh, now Oral-B. Strong teeth Oral-B, fresh pet Oral-B, 24/7 with Oral-B. Strong teeth Oral-B.
Give on our teeth 24 hours protection. Use Oral-B today. Na Nigeria Dental Association. Tanda Gidigba with Oral-B.
Is that Alfie playing football in the rain?
It's Toby Chio.
My goodness. When did he grow up? That's it with kids, though.
It's amazing how your child grows up before your eyes. Enable their thriving development with the new NanKid 4 with HMOs to support your child's development, probiotics, and high-quality proteins to support age-appropriate growth. NanKid 4. Nourish your child's potential.
Dry deodorant will help you maintain your steez. It only for 25 ml small size for boys and girls with sabi.
In the cooking game, you need a winning game plan. I'm not just talking about your fresh ingredients, utensils, or cooking skills. I'm talking about your choice of seasoning. My game plan is incomplete without Maggi chicken flavor. Made with a flavorful formation of onions, celery, turmeric, it's my game changer. Elevate the taste of your everyday dishes with delicious rich chicken flavor. Oh yeah, let's go.
New Maggi chicken flavor, my game changer.
Imagine that your car engines are running smoothly. Plus, you get instant cash or airtime rewards for that. You don't have to imagine any further in the AP Lubricants Instant Rewards promo, where everybody is a winner. From the 1st of August to December 31st, 2025, buy Visco 2000, Super Visco Static, HD40, or any other AP Lubricants grade and get 200 naira for 1 liter, 400 naira for 4 liters, and 1,000 naira for 25 liters. Just like that. No delays, no stress, instant cash out. So hurry now. Visit any AP filling station or accredited seller near you to get your AP lubricants and come out a winner. Terms and conditions apply. AP Lubricants, engineered for excellent engine performance.
Here you go, dear.
Mom, you didn't add milk.
No need to. Taste it and see why.
Wow, but how?
Is it milky?
Yes.
Is it creamy?
Yes.
That's Milo 3-in-1 milky and creamy for you. It's so milky. I don't need to add more milk.
I love it, Mommy?
Give your kids Milo 3-in-1, milky and creamy. It's truly milky. It contains calcium to help your champ win every day. Milo, energy to go further.
Milo!
E get many things where they gbadu pampe for. You fit dey transfer yafun free of charge.
Tell me more.
Data and airtime na cheap on top pampe.
No be tori na dey hear.
You pay for something, give you something back. No be play.
No be cashback be that.
Dem still sama you reach 20% kule interest on top saving.
This better. Na more.
Na app we get many enjoyment and jollification. Na pampe. Say yes to more.
It's time for back to school. Looking for a reliable pen? With Big Crystal Original, forget your worries. It flows smoothly over paper. No more running out of ink. Big Crystal Original is the pen that writes up to 3 kilometers for your notes, exams, and scribblings during class. Big Crystal Original, a pen you can rely on.
Ever wonder why Mamado oil makes some meals just unforgettable?
That stew you made last week. I have been thinking about it every day.
Or why your taste buds can't forget Victoria's Crunchy Chicken.
Bestie, please tell me you made fried chicken today.
Or even why your children always want to play in Auntie Kemi's house.
Mommy, can we go to Auntie Kemi's house?
When it comes to delicious tasting meals, it's Mamador. Mamador oil is available in stores near you and also available in pocket-friendly sizes. Use Mamador oil today.
Little body, big moves. Little brain, big learning. Your little child is eager to do big things. Every sachet of Cerelac Junior comes with the nutrition they need: natural grains, protein, and iron to support their physical growth, learning, and development. So you can fully enjoy your little one's big moments of growth.
Hey, I'm back with some more exciting information for you. So last week, we had the conversation about progress. And I asked the question, what does progress mean to you as an individual? You know how different things have different meanings to different people? We were talking about progress, and I said, what does progress mean to you? And a lot of people had different things to say. They said progress means money. Some said progress means buying their favorite meal. Some said progress means fulfilling your dreams. Well, those are all correct answers. But you see, whatever you define progress as, the truth is that to progress faster, you need a partner to help you get there. It could be your spouse, it could be your friend or your family that's gonna be there to encourage you every step of the way, to help you progress. So are you looking for a good partner to help you progress? Well, the guys at Money Points are made just for you. These guys at Money Points are made for moving you from start to success. From entrepreneur to mogul, Money Points is the partner you need as you navigate life. Money Points is built for your progress. Whatever progress means to you, make it happen by opening a Money Points account today. Do you plan to start a business, or are you an entrepreneur that plans to grow your business? Or do you just want to have a good life? What are you waiting for? Hurry up now and set up your very own Money Points account to make sure that you progress every step of the way. Money Point is made for your progress.
The conversations you hear on Nigeria Info.
United Nations, Atiku, Obi, and of course, a senator from Borno State, Senator Lindume, all are outraged over the killings that happened over the weekend in Borno State.
Both UN and United Nations, all of them are shookers, because all of them know the problem of this country, they know how it starts. All of them are involved.
These people, of course, Nigeria, I don't think they have the interest of Nigeria at heart. As far as they are concerned, Nigeria is a business enterprise, and they're only interested in milking the country.
The Lagos APC has denied claims that it's actually attacked ADC members in Alimosho.
Even if you're not pointing fingers to the APC, the police should swing in to find out who did this, right?
Conversation never stops. 99.3 Nigeria Info. Let's talk.
This is Morning Crossfire on 99.3 Nigeria Info.
Welcome back to the Crossfire here on Nigeria Info 99.3. I am Sheriff Quadry. It's great to know that you are there joining us on this conversation this morning. Very, very important. If you're in Lagos, this is a conversation that you want to have. I've got joining me Dr. Abimbola Osinowo, manager of the Lagos State Malaria Elimination Program at the Lagos State Ministry of Health. Dr. Osinowo, thank you again for giving us your time this morning.
Thank you so much for having me.
Yes, indeed. Now, let's start from this particular area. By the way, Merchant Man, you may want to call back. I will have enough time to get your question in. But not now. I need to drop this question first before Dr. Osinowo clear my next line of questions that I have. Let's talk about the malaria pre-elimination as defined by the WHO. I know that Lagos State has a program regarding this. Talk to us about this.
Okay, so the pre-elimination program that we are doing in Lagos, like I mentioned, our prevalence is quite low, and we're actually at the pre-elimination phase, being that from 0 to 5%. So as it is, we are more or less eligible, to speak, to ensure that we get malaria to elimination levels in the state. Now, what is happening is we understand that a lot of individuals, should I say, you and I, everyone, most times, visit the private sector. Private sector comprising of pharmaceutical service providers. These are the pharmacists, and then the community pharmacists and chemists. Then private facilities like the hospitals, clinics, before they eventually come to public hospitals. So as it is, our data is actually resident in these places. Unfortunately, we don't have we don't have enough resources to capture that data, because we have a data platform, the DHIS, that's the health systems platform, which is a national or even a global platform where all disease entities, district health information systems platform, all disease entities are rendered there. So at any point in time, by any eligible person, you can actually see what is going on in each of our respective countries. So that data is resident outside of the DHIS, the data platform. So what we want to do is to ensure that we capture every single person to understand what the true picture of malaria is in Lagos. We have said it's 2.6%, but then we actually have hotspots. So do we have existing hotspots? Do we have new hotspots? Are there other people we need to start to consider in terms of our malaria management? Because we've talked about the vulnerable groups. How about children between the ages of 6 and 12? Are they reservoirs for mosquitoes, for malaria, sorry? Do we need to just start to think of interventions for these age groups? So those are the things that we're looking at in the pre-elimination. Like I mentioned, when you get to the pre-elimination phase, you want to ensure that you are doing active surveillance. Active surveillance, you are looking for cases for malaria. So we are going to start considering travel history as well, because we know that as the prevalence is low in the state, if you see cases, we want to know, are you coming from a place that already are you from a malaria endemic area, or is it a malaria that is actually in the state, so to speak? That is where genomics also comes in. So I want to know, are these mosquitoes that we are looking at, are they really the state? Are they mosquitoes that are in? Are these the alleles of the parasite that we have checked? Are they really the malaria parasites for the state, or are they imported malaria parasites? So we are doing what pre-elimination also entails is a lot of active surveillance. We are going to look for malaria cases, and that is what the digitized pre-elimination pathway is all about. We are trying to get the data from selected pharmaceutical service providers. Let's see what the picture is. Beyond that, we also want to ensure that we get a lot of travel history, and then we want to start doing genomics as well in that regard.
Brilliant. That's brilliant. Let's talk about access to care very briefly. We touched on it when we discussed the most vulnerable groups, the children and the pregnant women. I want us to now look at it from the angle of our primary health care centers. I know one area Lagos government has done quite well. Big shouts to Professor Abayomi and his team, yourself, and the rest of the people. Primary health care centers are quite functional in Lagos, which is something to be proud about. But can people go to primary health care centers to have this checked? I mean, tests and treatment. Is this available at the primary health level?
For malaria, all our public facilities, so we are looking at the 3 levels of care: primary health centers, general hospitals, and our tertiary facility, which is the Lagos State University Teaching Hospitals, give malaria treatment for free. So we're looking at prevention, our nets to eligible persons, eligible pregnant women and children under 5, sulfadozine pyrimethamine to prevent malaria in pregnancy, my MRDT test, that's the malaria rapid diagnostic test kit, to diagnose if you really do have malaria. And then if it's positive, then definitely you get your treatment. So we don't in any way encourage the situation where people can come in to say, I know I have fever and this is how I feel when I have malaria. If you test it and it's positive, why not? But if it's negative, rest assured it's not malaria. And what is going to happen is we keep on using medications arbitrarily without a cause for it, then you would end up having resistance, and that would also be very detrimental to us as a country and as a state and as a country.
I mean, what you have said now quickly just flashed my mind back to a question I had skipped earlier about self-medication. How prevalent is this in Lagos, Dr. Osinowo, self-medication?
We have access to a lot of places where we can get medication. So malaria is over the counter. Malaria medication is over the counter. So anybody can get access to it. What it also means is that I can just walk into a facility and, without even getting tested, I can buy for myself, I can buy for my family, I can buy for anybody. I'm just coming to the facility or get it to a pharmacy and buy the medication. So what we are trying to ensure is that you don't just get malaria medications for you don't just get you just don't buy over the counter as such. That's why I talked about pharmaceutical service providers. When they come in, then they would understand that, or as we are doing now, that it is necessary for you to get them tested before treatment. And another thing is somebody can just walk in and say, well, I'm buying for my relative, maybe a child or my spouse or somebody in the house. It is important for you to bring that person. Let's get the blood sample tested. Let's get the person tested first, because it may not be malaria. And then you will have a situation where the drugs are not working and you are complaining that the malaria medication is fake. It's not as if it's fake, but what you are treating for is not malaria. So definitely it will not work for it. You are putting a square peg in a round hole. That is not how it's supposed to be. That's not what it means. You're meant to take malaria medication for malaria. Not malaria. Not malaria medication for malaria.
Because, we lost the last few sentences. That if you can just track back a little bit, because the network was breaking over here.
Okay. So
it hasn't changed.
You mentioned self-medication, and I said malarials arbitrarily.
Okay. Please go on.
Better?
Go on now. Yes, it's better now.
Yeah. Okay. So you take anti-malarial for what is not malaria. The person may have stress and is taking anti-malarials and is complaining that the person you are not getting any better. You have a cough, you think it's malaria, you're not getting any better. A diarrheal disease, you think it's malaria, it's not getting better. Typhoid, you think it's malaria, it's not getting better. It's not as though the medication is not working, but you're not using it for the appropriate disease. So what is happening? It's like you putting a square peg in a round hole. There's no way it would function. But you want to. That's why it's important that you get tested first before you start using any form of medication.
All right. Let's talk about vaccine, Dr. Osinowo. Malaria vaccines like the RTS.S, Mosquirix, and the newer RT21. They've been rolled out in some African countries. What should Lagos residents know about these vaccines?
Okay, let me take you back a bit, because sometimes it's good to understand where it started from. Then you can appreciate where we are.
Right.
Malaria vaccine started. It's not just it didn't just start now. It has been in process since. And when it eventually when they were able to get enough, when the efficacy of what was gotten was adequate, or should I say was functional, Three countries were enrolled to start, and these countries were Ghana, Malawi, and Kenya. So what happened is the pilot was fantastic. So they decided why not expand the scope. So what countries now started applying, requesting for vaccines, Malaria, Nigeria being one of them, and we're giving some doses. However, it isn't adequate. So what has happened is malaria vaccine as it is now is being rolled out in two states, Kebbi and Bayelsa. Kebbi because it has the highest prevalence in the country. I talked about Lagos having like three, if you get 100 people, like 3 individuals probably have malaria. In Kebbi, it's a 50%, almost about 50% prevalence. So what it means is that if 2 people are standing, the chances that one person has malaria. So it stands to reason that the vaccine is rolled out there and then Bayelsa. So the first phase that we have in the country are those 2 states. What is happening is for vaccines in Nigeria, it's going to be phased. So gradually, other states will be incorporated. Eventually, everyone will be carried along. But as it is, only 2 states are beneficiaries at the moment.
Indeed. Let's go to the telephone lines because before you know it, time will be over and won't be able to engage. Let's take more calls from Lagos this morning. 0201 277 0993. That is 0201 277 0993. At least I now know why Lagos is yet to have the malaria vaccine. You provided an explanation to that, and thank you for that, Dr. Osinowo. For the women, for the female callers only, please try this number 0201 465 7190. That is for female only calls. 0201 465 7190. Let's begin the calls now. Good morning to you.
Good morning, Sheriff. This is Kenny again.
Welcome, Kenny.
Yeah. Good morning, Doc. Thank you for your submission. I really appreciate it. Could you please elucidate very clearly for us, because I know that there are 2 approaches to malaria. You have the prophylactic and you have therapeutic. So it's like when we have fancida and everything. Can you share with us that aspect? Then number 2, I've also noticed that there's a propensity for some people who their chemical makeup repels malaria apparently, repels mosquitoes apparently. Can you also shed light on that so that people would know that, okay, I am tended towards attracting mosquitoes, so I need to be extra careful. Thank you. Have a good one.
Thank you, Kenny, for your thoughts. Doc.
I didn't hear the question.
Oh, you didn't get the question. All right.
No, I didn't.
All right. First question Kenny asked was that probably you need to, she would like for you to explain the 2 approaches to malaria care. And she mentioned prophylactic care and the other care. And then she also wanted you to explain some people's genetic makeup. She would like you to explain whether truly some people attract mosquitoes naturally, and some people naturally their body repels mosquitoes. So she wanted you to elucidate on those questions. Okay.
In terms of the genotype, I'm sure that's what she's referring to. It's genotype AA, because I assume that genotype AA tends to have malaria more than the AS, and it stands to reason. The samples required. Let me put it this way: AA had what it means is that the blood samples, the cells are spherical, so they are normal shaped, unlike AS that has a sickle shape. So when one has malaria parasite, or should I say when one has malaria, the parasite tends to feed more in the AAs. The S, even though they are there, they eventually get destroyed in the spleen. So definitely, at the end of the day, the AA samples have a lot more parasite compared to the S, which are destroyed. So definitely, AA genotype actually gets, should I say, they are more, they tend to have a lot more malaria compared to the other AS genotype. But the first question, I didn't get that one very well. Can you kindly repeat it?
She was asking about prophylactic care.
Okay, prophylactic care is actually is mostly for our pregnant women, and then people with diseases like sickle cell anemia. And for our pregnant women, I mentioned it earlier that it's intermittent preventive therapy in pregnancy. That is the so-called pyrimethamine. And our children, our individuals with sickle cell, they use a combination of drugs. I can't start saying that on air right now.
Okay.
But generally, prophylaxis is centered around pregnant women and people that have any form of disease like blood disease like sickle cell anemia.
All right.
We are not meant. We don't have any drugs dedicated for individuals with normal cell, or should I say that for adults? For generally, we don't encourage as such. That's why we recommend that you use nets and our ACTs, the artemisinin-based combination therapy, the medications that we use for malaria treatment. They are not meant for prophylaxis. They are meant for treatment for malaria.
Okay. All right. Let's take another call quickly. Let's see who is here. Good morning to you.
Yeah, hello, good morning.
Yes, please.
Yeah, my name is Nathaniel. I'm calling from Bejuleki.
All right.
Quickly, your guest, Irina, she's a professional. She is actually.
What's your question quickly?
Of recent, the weather in Lagos was something else. The cold weather actually, brought so many people down with malaria and typhoid. So my question is, why?
My word, that call actually dropped. Nathaniel, do try and call us back if you can, okay? Good morning to you.
Good morning, Mr. Sheriff.
Good morning
to you and the doctor. My question this morning is, owing to the fact that people can readily access malaria drugs over the counter, what's the doctor's message to those who feel prevention is better than cure, due to the fact that even antimicrobial resistance is also a bane on malaria treatment? Secondly, the elderly, are they captured in this vulnerable group whenever they walk into the facility? Those are my questions. Thank you, sir.
All right. Doc, did you get that?
No. The question, I can't really hear the audience as such.
Okay.
Can you repeat the question? One at a time, please, so I'm able to answer.
All right. Let's start with the elderly part. She wanted to know if the elders are properly covered in that vulnerable group.
No. The vulnerable group for malaria, pregnant women and children under 5. Elderlies are not captured as vulnerable group in malaria. They are a vulnerable group, but for malaria, it's those two individuals I mentioned earlier that we refer to as a vulnerable group.
Mr. Boli, please pardon me. I need to take other calls. Let's stick to one question. Good morning to you.
Hello, good morning once again.
Morning.
This is the Mashak man.
Please, straight to the point, please.
The question I was asking then is, where she said, even though some people will be diagnosed with malaria, yet the treatment could not go. The question I want to ask is, the GMO issues that we have that beget is spreading. There are GMO mosquitoes. What do she have to say about GMO mosquitoes that has really caused people to treat malaria and they don't?
There are GMO mosquitoes. Okay. All right. Merchant man. So there you go. Doc, he is asking about GMO mosquitoes that he said he claimed that Bill Gates spreading GMO mosquitoes. That what are you doing about it?
I'm not aware about GMO mosquitoes. I'm actually hearing that for the first time. I'm not aware of any GMO mosquitoes. Although they have mosquitoes that we call they're sterile. There's a technique, sterile insect technique. We don't have that at the moment in the country. But what the intention is that they will the male mosquitoes are sterile, such that when they mate with female, they do not in any way their sperm do not in any way hatch the eggs. So that's one of the methods of malaria elimination. But it hasn't yet been incorporated in the country as it is.
Indeed. Well, we have to leave it here for this morning. We've had a great conversation regarding malaria and how Lagos State government is approaching this particular situation. This morning, Dr. Abimbola Osinowo, thank you so much for joining us on the Morning Crossfire.
Thank you so much for having me.
Shebi, when the vaccine comes, you will let us know.
Oh, definitely. I don't even need to say much. Okay. Everybody will be aware. Sorry, vaccines are strictly for children from about 5 months to 15 months. They can extend it to 23 months if the child did not start on time. But there are 4 doses at 5, 6, 7, and at 15 months.
All right.
Despite the vaccines, the children are meant to still sleep inside mosquito nets. So it's not as though they are prevented totally, but they don't have the severe form of the disease when they do have. So I want everybody to take note of that.
All right. Dr. Abimbola Osinowo, Manager, Lagos State Malaria Elimination Program, Lagos State Ministry of Health. Thank you so much for joining us again.
Thank you very much for having me.
All right.
Take care.
Lagos, that's our show. It's produced by Zainab Yakin. I'm Sheriff Quadry. Thank you for being a part of the Morning Crossfire. Tomorrow is Open Mic Friday. I can't wait. But I'm not gone yet.
You are listening to your number one station for talk.
99.3 Nigeria Info.
99.3 Nigeria Info. Let's talk. See, 99.3 Nigeria Info. We are more than just radio. Subscribe to our YouTube channel at Nigeria Info FM. Check us out on Facebook at Nigeria Info 99.3. Follow us on Twitter at Nigeria Info FM and on Instagram at Nigeria Info FM Lagos for live updates as it happens.